I might just ask Mairi if she wants to open us up and welcome everybody here today.
Oh, tēnā tātou katoa, kia ora Kiri, kia tātou katoa kei te mihi, ko Mairi Lucas tōku ingoa, ko Mauao tōku maunga, ko tauranga te moana, ko Ngāti Ranginui te iwi, ko Ngāti Hangarau te hapu, ko Hangarau te marae. Nau mai haere mai ki tēnei wāhanga o tātou i tēnei wā, ngā mihi nui kia tātou kua hui hui mai. Thank you everybody for coming this morning. I'm Mairi Lucas, I'm the Professional Services Manager for NZNO, and really keen to be involved in the recordings and the question and answer panel that we are today. Really keen to hear perspectives from the past and knowing how you feel about how nursing is today, and especially and in particular the organisation NZNO. I know you've all had a long history of involvement, and looking forward to hearing from you all. If we can just quickly whip around and introduce ourselves, that would be really good so we know each other. Kia ora, Margaret, would you like to start?
Kia ora. I guess I'm here because I'm an ex-president of the association, or it was the Nurses Association in my day, and I was president from 72 to 74. My background was mental health. I was actually matron of Sunnyside Hospital at that time, and I was brought in to be president at a time of great threat to the association. And I guess I was brought in because I had an experience on the industrial side of those days. So that's basically, I guess, why I'm here.
Well done. Thank you, Margaret. Ash. Kia ora.
Morena koutou. Ko Manapo atu te mauna, ko Waikare moana te awa, ko Tūhoe te iwi, ko Mātātua te waka, ko Tamakai moana me Ngāti Rere nā hapu, ko Tanatana me te Māpau nā marae, ko Ashley Hemi taku ingoa. I am a Year 2 tauira, Year 2 student up in Tauranga at Toi Oho Mai. And it's great to be a part of this panel this morning. Kia ora.
Kia ora. Beverly.
Oh yes, good morning. Beverly Henderson. I'm not quite sure how I got on this panel. I believe I was nominated. I've yet to speak to that person. And my background, I commenced my nursing training in 1965. I've been retired 4 years now. During that time, I worked for almost 40 years as a midwife and then moved to perioperative nursing. And my interests have been obviously midwifery and women's health and perioperative care, and that's my background. I am an honorary member of New Zealand Nurses Organisation, an honour which was bestowed upon me a few years ago, which I am very, very proud to have, so thank you.
Kia ora, Beverly. Whaiahine Raumoa.
Tēnā koutou katoa, ko Taki te Musawaka, ko Ngāti Kahungunu mea nai tahu tuku iwi, ko hine rau te apatu ingoi. I go back, I'm probably older than a lot of you there altogether, but basically I worked in the private sector, and I became more involved in, in NZ, it was New Zealand Nurses Union actually, under Stephanie Breen, but they kept at me because they needed to have somebody come in to involve Māori caregivers and Māori nurses in the private sector. And as much as I tried to rebel against it, I ended up taking a position as a nurses organiser. and I went through the period of the amalgamation of both NZNA and Nurses Union under Stephanie Breen. It's been quite a big journey, really, and I was the one given the opportunity to try and create the Rūnanga to look after our Māori service workers, our Māori nurses in private sector. And at stages, it probably was the most tumultuous of all things I've ever come across, because it was a fight right from the start. Things have progressed, and it's been up and down. But thank goodness we've got a person like Kerry who's been so forward-thinking. So my position actually was that of supporting the Rūnanga to make sure that basically it was recognised as an identity on its own. So it's been a journey. I'm getting a bit old now, I'm in my 80s, and I'm still involved in some way. But I guess I'd miss it if I wasn't involved in any way. And it's nice. I don't know who you are except for Kerry. I know Tracy. But probably at some stage I'll get to meet you all. Thank you.
Kia ora, Whaia. Tracy's left the room by the looks of things. So, Kerry.
Morena koutou katoa, ko waiau, ko manga haruru, ko taki timutu waka, ko Ngāti Kahanunu te iwi, ko Ngāti Tū te hapu, ko Tangoia te marae, ko Kerry Nuku tōku ngā, he kai whakahaere tōku tangata pohi, kai te aki o Aotearoa, the New Zealand Nurses Organisation. It's a pleasure to have you all part of the panel. And as Margaret, Ash, Beverly and Whaiahiniro Moa have said, the reasons why we're here hopefully unfolds as the kōrero evolves, but it is about capturing people that are new to nursing on their starting their journey, others that have been instrumental and part of that change for the organisation, and people that have got wisdom to contribute. So hopefully that comes through. I'm not sure. Okay. So this is it is a phenomenal year. It is an extraordinary year. I don't believe when we were sitting down opening up our Christmas presents in December that we could have quite anticipated that there would be a pandemic that we'd have to cope with, that would be an eruption that we'd have to manage. But each one of these occasions have had each one of these significant events has called upon the role of nurses to rise to the challenge time and time again. So the panel, and I know as nurses we are all humble people, so we are honoured to have Dame Margaret Beasley with us, whose career spans not just nursing but has influenced far more wider than just the area of health, but justice and the tribunals, and has a long history outside of nursing, and is also the patron of the Nurses Education Research Foundation. Ashley, who is in her second year, but also is the first person to be elected to the International Council of Nurses Youth Forum, and picked and selected out of a handful of members across the globe, even during this pandemic. Beverly, for her years of service and her advocacy and challenge in quite different times, and recognised as an honorary member, and Whaiahiniro Moa for her instrumental work around developing the Rūnanga, working through both association and an organisation, and also trying to start what was quite a contentious issue, embedding the biculturalism journey which we're on today. So you are all equally skilled, you all offer such great wisdom to this table, and it is a pleasure to have you here, albeit a little bit strange that we're in your lounges or at work and not sitting together on a panel traditionally as we know it, and then where we could then break after we've had the session and then have a cup of tea together. So these are really unusual circumstances, but thank you for your tolerance and engagement.